For our video for this week, I thought that we'd send out a video talking about adrenal fatigue or adrenal insufficiency. It's a new area of medicine. We've always known that there was such a thing as what's called Addison's disease. That's when the adrenals quit functioning. If you don't take cortisone and flucortisone, you die. It's quite rare, actually. And then there's problems with too much cortisone, essentially Cushing's disease. We used to think there was only these two illnesses. So you had no cortisone, normal cortisone, and too much. But we're now realizing there's a spectrum which some people have called adrenal insufficiency. It's not really that there's no adrenals, but you don't, or no cortisone, but your cortisone levels aren't functioning right. You see, God made us when we wake up in the morning, this big boost of cortisol to get us going and functioning, and then it drops down in the afternoon, evening to nothing. But what we find in people who have adrenal insufficiency and what many doctors call it adrenal fatigue, that is reversed. And the cortisol levels are low in the morning. They sort of start to peak up a little bit, and by late afternoon, they start to get a little bit higher, and then they drop off. So the typical, and these patients, when they have this reversed problem, they are tired, fatigued, and nothing, they just feel wiped out all the time. They feel tired, they can barely drag themselves up out of bed. Now here's the neat thing. There's a simple way that you can ask yourself, is this something I should consider? Number one, do you wake up tired? Number two, do you get a second wind in the afternoon and you have trouble going to sleep because you've got too much energy? Those patients should be assessed. There's other things that'll do that, but that's one of the things that need to be looked at. These patients typically have waking up problems in the morning. They have improved energy in the afternoon. They have typically very poor stress tolerance. The other thing that is a hallmark that when this happens, you need to look at this. They crave salt and they crave sugar. There's some biochemical reasons why this is so, which we won't go into. But that's a simple little tip-off that if you have marked salt craving and marked sugar craving, your adrenals should be considered and assessed. What are things that you can do? And there's an awful lot of things that you can do as a patient that are good health habits that can help this. Number one, lifestyle factors, stress management. There's some things that need to be done in stress management. And we have a counselor, by the way, Dr. Cowan, who's a marriage and family therapist, a PhD marriage and family therapist that can help our patients with this if you want to make an appointment. But there's a whole bunch of things with stress counseling, stress management that helps. Number two, no sugar, no alcohol, no caffeine, and most important, no high energy drinks. They deplete it and make it worse. Well, what about the person who drinks coffee 4 or 5 cups in the morning to get going, and then they feel that they get their second wind from the coffee? First of all, if you're taking coffee in the morning, all right, and you know one or 2 cups, probably is okay. In fact, there's studies and evidence that suggest 1 cup of coffee is probably good for you. More than that is probably not good for you. But here's the issue. Most people who are doing this are using the coffee as a stimulant to get their energy up and going. The issue that we as doctors have to ask is, why do they need that stimulant? Number two, coffee is addictive. Whether we like it or not, you get hooked on that. And the addiction process is that it gets less and less effective with time. You need more and more of it. So it's not a good choice to start doing that because literally you can get hooked on it. Number two, it's hard to get off it. Number three, you're not really treating often the root cause. Why are you there? You want to eat frequent, smaller meals, not just the typical person that does this, eats minimal things for breakfast, a little bit of lunch, and then a great big supper. Wrong way to go about it, all right? You want to do gentle exercising, walking, and things like that. There's some studies that suggest if you take 2 to 4 grams of vitamin C, that's 2 to 4,000 milligrams of vitamin C every day, that helps. Pantothenol or vitamin B5, about 1,000 milligrams, can help. And the last thing that often we do is in the office, if you have this problem, we can use an old treatment from many years ago called glandular extracts. The fact of the matter, there are no real studies to suggest that these work or don't work. But those of us that have been in medicine long enough, this is something that was used in the 40s and 30s kind of thing. We've seen these patients that respond well to it. There's no, it's sort of an empirical area of medicine. It's not something I have evidence to say this works or doesn't. But it is actually fairly safe to take. It's not that expensive, and it's worthwhile trying. And if it works, you will love me forever because it's like magic. These things, though, adrenal stress is often just one part of a lot of other things going on. But it's a very important thing. And the neat thing about adrenal insufficiency or adrenal fatigue, the important thing is that there's so many things that you can do. Decreasing your stress, getting counseling with your stress, doing these dietary changes. All of these things can make, in about 6 weeks to 3 months, can make magic. Take a person that's burned out all the time and give them a new lease on life. While we're talking about treatment, there's several things that we do in the office for these kind of things. And there's some things called herbal adaptogens. That's a big word for saying there's certain kinds of herbs that have been shown to regulate the adrenals and make them better. One of them is ashwagandha. Ginseng, a certain kind of ginseng called Panax ginseng works. Holy basil works. But there's different things like that. Another thing that's interesting, but black licorice helps. Now, you have to be careful with black licorice because it can raise your blood pressure. So you have to, this should be done under a doctor's control if you're going to do that. And the last thing, many of these patients are deficient in the precursors to build cortisol, which is pregnenolone. And sometimes we have to give them some precursors to help that until their dietary issues correct themselves.